Welcome to my YouTube channel. Today we're going to talk about fetal warfarin syndrome, or also called as fetal embryopathy. Kindly make sure you subscribe, it will cost you absolutely nothing. So now what happens? Now let's look now deeply what happens when you give warfarin in pregnancy. So when you use warfarin in pregnancy, then we said it crosses the placenta. So when it crosses the placenta, the mode of action of warfarin, as I said, it's a vitamin K antagonism. So it inhibits vitamin K regeneration by the reductase enzyme in the fetal liver. Now we are in the fetus. So in the fetus, now we'll have decreased vitamin K, and in addition to that, we'll also have um, so, so when we have decreased vitamin K, which acts as a cofactor of glutamine carboxylase enzyme. This glutamine carboxylase enzyme usually add carboxyl because it's a carboxylase enzyme. It usually add a carboxyl groups to the glutamine residence of which factor. These ones you have to know: factor 2, factor 7, factor 9, and factor 10. Factor 2, factor 7, factor 9, and factor 10. So now, because we don't have these factors are not active, we are prone to bleeding. So then we have decreased production of the clotting factor 2, 7, 9, and 10. So in the fetus, we'll have increase of bleeding. So the patient can breathe, for example, intraventricular hemorrhage, among other bleeding. In addition to that, it can also cause spontaneous abortion. In addition to that, it can also cause fetal warfarin syndrome, which I mentioned in the previous slide, and I want to mention it again. Fetal warfarin syndrome, which is also known as warfarin embryopathy. So 5% of the exposed offspring usually develop this congenital malformation. And it's said before this is due to exposure during the first trimester of pregnancy, and the following are the clinical manifestation. And you're going to begin with the skeletal anomaly. In the skeletal anomaly, you're going to have stripped. So just the warfarin embryopathy is going to affect mostly the cartilage or the endochondral classification. So you'll have stripped non-calcified epiphyses, you'll have short finger that is brachydactyly, then you have nail hypoplasia and also silicosis. In facial abnormalities, you can have this is most common: nasal bone hypoplasia, nasal bridge depression, as seen in the picture above. In addition to that, you can also have CNS anomalies, and this is when you have intellectual disability as the child grows older, seizures, and then ventriculomegaly.